Bonjour à tous et aujourd'hui le docteur Wong va nous faire une présentation sur le thème des modules de formation par simulation en accès libre et auto-évaluation sur la fixation externe modulaire des fractions ouvertes de la tige des extrémités. You can get started, Dr. Wong.
Oh, sure, no problem. Bonjour tout le monde. Je suis Dr. Julian Wong. Je suis canadienne. Je parle un petit peu de français, but most of my presentation today will be in English. But as I mentioned just before we got started, that in fact, I will be presenting our open access online self-assessed orthopedic surgical training modules, which are designed for practitioners who are not orthopedic surgeons. And this is all available online. It's on a wiki-based platform called Apropedia, and it is automatically translated in over 133 languages, including Haitian Creole.
Sorry, could you slow it down a bit so it can get translated?
Oh, sure, yeah, no problem.
Bonjour à tout le monde. Mon nom c'est Dr. Wong. Aujourd'hui, je vais faire une présentation sur les fractures ouvertes et les modules sont disponibles en ligne sur une plateforme que vous pouvez consulter et c'est déjà traduit en plusieurs langues, incluant le créole.
Okay, merci beaucoup. So a few years ago, I joined a team actually, and we are a international multidisciplinary team of both surgical practitioners as well as creative technologists and even people of very, very diverse backgrounds actually. And we came together to try and come up with innovative ways that medical officers and physicians who are not surgical specialists could actually teach themselves new surgical skills.
Il y a quelques années, j'ai commencé à faire partie d'un groupe qui est tout à fait divers de chirurgiens et de techniciens à travers le monde. Et l'idée, c'est de créer un module pour pouvoir fournir des informations pour que les médecins qui ne sont pas des chirurgiens peuvent prendre soin des fractures ouvertes.
We also believe that creating diverse, equitable, and inclusive teams really fosters innovation.
Nous croyons aussi qu'avoir une équipe qui est diverse et équitable va faciliter la promotion d'une formation qui est équitable.
And we would certainly encourage anybody who's attending today's lecture, if you're interested in joining our global community of healthcare innovators, patients, and healthcare providers, you are most certainly welcome to to approach me afterwards and get involved.
Et nous lançons également un appel si nous avons des participants qui veulent nous joindre, vous pouvez m'écrire et on peut vous donner l'information comment vous pouvez faire partie de notre équipe.
So we've actually been working on a number of different modules to allow practitioners anywhere in the world at any stage in their career to teach themselves new surgical skills.
Et nous avons d'autres modules que nous avons travaillé pour pouvoir aider les médecins qui ne sont pas des chirurgiens pour pouvoir prendre soin de diverses techniques chirurgicales.
And these range from pediatric surgery to orthopedic surgery and even obstetrics and gynecology.
Et ces modules vont en rapport à des problèmes gynécologiques ou obstétriques, des problèmes pédiatriques et des problèmes chirurgicaux.
So over the past almost 2 years, we've been working on a number of different modules, but there have been other teams across the world that have also been creating what we describe as self-assessed surgical simulation training modules. And sorry, go ahead. Yeah.
Au cours des deux dernières années, nous avons travaillé sur plusieurs modules et il y a également d'autres équipes à travers le monde qui continuent à travailler sur d'autres modules de formation personnelle à distance où ces personnes peuvent faire des auto-évaluations et une fois qu'ils ils ont complété ces modules.
And so these range from laparoscopic surgery to orthopedic surgery to reconstructive surgery and hemorrhage control techniques and even cardiac surgery, and as well as I mentioned before, obstetrics and gynecology.
Ces modules sont très variés et divers et vont à partir de la colostectomie laparoscopique, des chirurgies ouvertes, des fractures et même des modules en rapport avec la chirurgie cardiaque. Et ces modules sont très divers.
And so these modules are all available online. They do not require you to create an account. You do not have to put in a username or password. And all the material is freely available. And you don't have to, there's no fee to access the training content.
Ces modules sont disponibles en ligne et ils sont gratuits. Vous ne devriez pas créer un compte. On ne demande pas des mots de passe, on ne demande pas des frais. Ils sont tout à fait disponibles de façon libre et sans aucun frais.
So why don't we get started on one of our modules that we've been working on developing. And this one here is on a modular external fixation of open tibial shaft fractures, which we know is actually one of the most common fractures that are sustained by people worldwide. Particularly open tibial shaft fractures most commonly result from motor vehicle accidents, and they typically affect young adult men who are, often the sole or primary breadwinners for their families, and not having access to an orthopedic surgeon to properly surgically manage these fractures, of course, can lead to needless suffering, disability, and potentially even death for these trauma patients.
On va commencer avec un de nos modules, c'est la fixation des fractures tibiales externes. C'est un module qui est online, c'est une pathologie qui affecte principalement les hommes ou les femmes dans l'âge moyen. En général, ce sont liés avec les accidents de la voie publique. Et il y a beaucoup de ces fractures à travers le monde. Et en général, il y a beaucoup d'endroits où il n'y a pas, ces patients n'ont pas accès à un service chirurgical équipé. Et ceci peut aboutir à beaucoup de morbidité et même de la mortalité. Et ces gens, en général, sont les principales personnes qui sont en charge de leur famille.
And our team lead is an orthopedic surgeon based at the National Hospital in Abuja, and he has informed us that Nigeria is a country of 206 million people, and there are only about 400 orthopedic surgeons, serving that very large population. The gold standard is one orthopedic surgeon for every 200,000 people, and also to make it more challenging is that 3/4 of the orthopedic surgeons in Nigeria are located in 4 major urban centers. So Nigerians that sustain open tibial shaft fractures or other types of fractures outside of these 4 major cities will not have access to an orthopedic surgeon.
Et notre chef d'équipe est localisé au Nigeria. Le Nigeria, c'est un pays qui est très vaste, avec plus de 200 millions d'habitants. Il compte environ 400 chirurgiens orthopédiques pour une population qui est si grande. Et en général, ça fait un moyen d'un chirurgien orthopédique pour 400 000 habitants. Et la majorité, environ 3/4 de ces chirurgiens sont localisés dans les 4 principales villes urbaines. Il y a beaucoup de patients qui ont des besoins orthopédiques pour des fractures qui n'ont pas accès à des chirurgiens orthopédiques.
So what ends up happening is if a patient in Nigeria sustains a fracture, and since there are not enough orthopedic surgeons, you know, spread out geographically, then more often than not, these patients end up under the care of traditional bone setters.
Ce qui arrive principalement si une personne a une fracture ouverte du tibia, en général, la majorité de ces patients n'ont pas accès à des chirurgiens orthopédiques. Ils vont en général être pris en charge par des médecins traditionnels dans leur communauté.
And so the problem with that is that these traditional bone setters use unsuitable practices to manage fractures. Typically, their approach is to tightly splint a fracture, and this, of course, can have devastating consequences for the patient, namely compartment syndrome, which then can lead to gangrene and potentially sepsis and even death.
Et ce qui arrive en général, ces médecins traditionnels vont utiliser des pratiques qui ne sont pas vraiment standardisées, et en général, ils vont essayer de stabiliser les fractures avec des techniques qui vont aboutir qui peuvent même aboutir au syndrome du compartiment, et ce qui peut engendrer de la gangrène, une septicémie et même la mort.
And as well, because most medical officers have no exposure to orthopedic surgery, you know, outside of their undergraduate medical education. In fact, many physicians will refer fracture patients to traditional bone setters because they do not feel comfortable managing fractures, and there are no other providers accessible in many places around the world.
Et ce qui arrive, des fois même, même les médecins eux-mêmes, ils n'ont pas reçu beaucoup de formation sur les techniques chirurgicales ou encore pour prendre soin des fractures, à part ce qu'ils ont reçu durant leur formation. On retrouve même des cas où les médecins vont référer les patients à des médecins traditionnels dans la communauté parce que ces médecins ne se sentent pas en capacité pour prendre en charge ces fractures ouvertes.
So on top of that, this year, you know, it's estimated that there are about 274 million people who are either, you know, facing, you know, a humanitarian crisis, whether it's through conflict or natural disasters.
Et on estime au cours de cette année, il va y avoir environ 275 millions de gens qui vont être déplacés en rapport avec des conflits à travers le monde et qui auront besoin des accès, l'accès à des soins médicaux, chirurgicaux à travers le monde.
And so in conflict zones, over 25% of injuries sustained in a conflict setting are open extremity fractures.
Dans les zones de conflit, environ 25% des accidents qui arrivent vont aboutir à des fractures en général, ou encore des fractures ouvertes.
And as well, in a natural, I guess, disaster like an earthquake, about 87% of injuries are actually orthopedic in nature.
Et en général, dans les cas de désastres naturels comme les tremblements de terre, et 85% des fractures vont aboutir à des fractures ouvertes.
And actually, after the Haitian earthquake back in 2010, actually, I guess the Israeli military had set up, I guess, emergency, orthopedic mass casualty care camps, and we're actually able to show that you know, you could set up a sort of makeshift, I guess, surgical tent and actually treat these open extremity fractures, which primarily were of the lower extremity, you know, with with a technique called, external fixation.
Et au moment du tremblement de terre de 2010 en Haïti, les militaires israéliens ont pu établir des centres ou encore des tentes chirurgicales qui leur ont permis de stabiliser des fractures, principalement les fractures des membres inférieurs. Et ils ont pu démontrer qu'en utilisant cette technique, on pouvait stabiliser les fractures ouvertes.
And the reason why modular external fixation can be performed in a mass casualty setting is because you don't actually require intraoperative X-rays to perform this procedure.
Et la raison pour laquelle on peut stabiliser les fractures ouvertes des membres inférieurs avec des fixateurs externes, parce qu'en général, on n'a pas besoin d'une radiographie intraopérative pour pouvoir réaliser ces procédures, encore cette intervention.
And the reason why is in the lower extremity, the tibia is so superficial that you can actually both visually and through manual palpation confirm if the fracture has been adequately reduced.
Et au niveau des fractures des membres inférieurs, en général, quand vous avez une fracture impliquant le tibia, on peut de façon manuelle repérer. Là, on peut placer les fixateurs sans nécessiter vraiment une radiographie. Parce que le tibia est vraiment superficiel.
So what we have done actually is we've created open access orthopedic surgical simulators that can be 3D printed anywhere in the world that has access to a 3D printer, and that would actually permit practitioners who are not orthopedic surgeons to gain the competence and confidence to perform orthopedic surgical procedures like modular external fixation of upper and lower extremity fractures.
Nous avons pu, à partir des imprimantes à 3 dimensions, et printer des matériels, des modules qui vont essayer de faciliter l'apprentissage chez les prestataires pour qu'ils deviennent confidents et avoir la compétence pour pouvoir bien placer un appareil de fixateur externe.
Simulation-based training has been used in aviation for decades, and it is a safe way for practitioners to gain the essential skills that they would need to feel confident and competent to perform procedures on real patients.
Les enseignements à base de simulation les enseignements en simulation sont utilisés pendant longtemps au niveau de l'aviation. On essaie de répliquer ces types de formations au niveau de la formation médicale ou chirurgicale pour pouvoir rapidement fournir ou encore établir un moyen de protocole pour que les pratiquants peuvent acquérir une compétence adéquate.
And so our 3D printed bone models are open source. They are available, they can be downloaded anywhere in the world and printed locally where there's a 3D printer. We and so our bone models are actually designed to have visual, tactile, and acoustic fidelity.
Et nos modules en rapport avec l'empreinte, les tibias sont disponibles dans une plateforme électronique et elles peuvent être imprimées à n'importe quel endroit où vous avez accès à une imprimante digitale.
So what that means is that our 3D printed bone models are designed to look, feel, and sound like human bone when you're drilling into them.
Et le type de module qu'on utilise ressemble à un os en termes de palpation et ils vont vous donner l'impression que vous touchez à un os approprié.
So as you can see here, this is one of our bone models in cross section, and you have the cortex of this tibial bone, but as well you have the inner cancellous bone.
Et si vous regardez une courbe transverse de l'os, vous pouvez voir la partie externe qui représente le cortex et la partie intramédulaire avec les fibres intraosseuses à l'intérieur.
And the reason why having this bicortical anatomy simulated in this bone simulator is because when you are drilling through the cortex, when your drill tip or your pin passes through the near cortex, then you actually know where you are in the bone, because when you've perforated the near cortex, you actually feel a tactile give when you pass into the cancellous bone. And then as well, you get tactile feedback when your tip then enters the far cortex. So you know where you are. And what we have the physician learners do is they will drill with a power drill through the near cortex. And then when they feel the tactile give and they're in the cancellous bone, and then they can feel that. And then once again, they feel when it's a little bit harder, when the drill tip, reaches the far cortex, and they can stop and then manually advance the screw into the far cortex, and which is much safer and will minimize the risk of the screw or drill tip penetrating the far cortex and potentially entering vital neurovascular structures.
La raison pour laquelle que nous avons l'os en 2 dimensions, c'est avec les 2 cortex. C'est après avoir utilisé l'appareil de drillage, quand vous arrivez à la partie interne de l'os, qui est beaucoup moins résistante, vous allez ressentir qu'il y a une faille, et à partir de ce moment, en général, on conseille à nos étudiants de continuer à avancer l'équipage de façon manuelle jusqu'à ce qu'on peut continuer à traverser la partie externe du cortex osseux.
And this is how and why it's possible to for physicians who are not orthopedic specialists to potentially perform this procedure, because there is a safety factor built into this procedure, because you're not power drilling through the far cortex, which really reduces the risk of what we call plunge, which is when the tip of a drill or ends up blindly perforating through the far cortex and potentially injuring underlying soft tissue structures.
C'est pour cette raison qu'il est possible pour les praticiens qui ne sont pas des chirurgiens orthopédiques de pouvoir réaliser cette intervention, parce qu'il y a un facteur de sécurité qui est à l'intérieur de l'os. Après avoir traversé le cortex, on peut ressentir qu'on est dans la partie, on est dans le canal osseux. Et ceci va essayer de limiter les complications qui sont liées lorsque la pointe de l'équipement traverse le cortex adjacent.
And as well, we designed in our bone simulators a vise attachment, which you can see here, and that allows, and you can also see here actually as well too, And that allows this bone model to be safely secured in a standard, table vise clamp to permit safe simulation training.
C'est pour cela, dans nos modules à 3 dimensions, on incorpore cet attachement à la base de l'os qui va essayer de renforcer et comme un élément de sécurité au moment du drillage de l'os.
And so our bone models, our open source bone models are designed to be made on desktop, user-friendly, open source, open filament 3D printers that cost as little as $200.
Et nos modules sont disponibles en ligne de façon gratuite et ils ont été dessinés pour pouvoir être utilisés avec n'importe quel ordinateur et qui ne coûte pas beaucoup plus de $200 si vous avez une imprimante digitale.
And as well, they're designed to be ready for use right out of the 3D printer, and they are made out of biorenewable plastic that costs as little as 2 cents per gram.
Et ces modules sont également ne coûtent pas cher, ils vont coûter environ de 2 centimes par kilogramme avec des matériels plastiques biodégradables.
And so as well, we've also added at the base of every model, we have drilling direction arrows, as well as a gender icon. So this is a male model because the cortex is thicker. And as well, we have a model number translated into the 6 official languages of the United Nations. And these features help any learner to identify the model and properly orient it for training.
Et à la base de ces modules, nous avons des indicateurs qui vont essayer de guider l'apprenant pour pouvoir appliquer ou encore choisir un modèle qui est approprié. Et ces indicateurs sont traduits dans les 6 langues officielles des Nations Unies.
So you may be asking, where can I find a 3D printer in Haiti? And our module helps you do that.
Et vous pouvez vous demander où est-ce que nous allons retrouver les imprimantes digitales à 3 dimensions en Haïti. Et dans nos modules en ligne, nous avons des renseignements qui peuvent vous aider à avoir ou encore obtenir une imprimante digitale à 3 dimensions.
So for example, here is one map of people who own a very, very popular open source, open filament 3D printer. And so we're just going to head over to your parts of the world here. And as we can see, there are 3D printers in this part of the world as well. Let me just go back here for a second. There are many other places that you can search. So here we have, there's another organization called Fab Labs, and this is a network of about 2,000 fabrication labs, many of whom have 3D printers, and they are in over 149 countries around the world. So,
et si vous allez dans notre site, vous pouvez rencontrer, il y a une carte qui peut vous donner différents endroits où vous pouvez retrouver des imprimantes digitales à 3 dimensions et vous pouvez les retrouver en République dominicaine. Il y a également différents endroits sur ce site qu'on appelle le Fab Lab qui peut vous aider à faire à obtenir des imprimantes digitales.
So there are many different places that will have 3D printers. here in my home country of Canada, we have 3D printers in public libraries. They are in schools. They are in universities. And so they can be found in many places.
Et il y a également beaucoup d'autres pays où vous pouvez trouver ces imprimantes digitales. Dans mon pays au Canada, il y a beaucoup de sites ou encore d'endroits où vous pouvez retrouver en ligne qui peuvent vous donner une idée du coût pour acheter ces types d'imprimantes.
In fact, there is at least one, I guess, fabrication lab that has 3D printers that we know of in Haiti. And it's called PAP Lab Haiti here. So, so if this is something that interests you, you're certainly more than welcome to reach out and see if, you know, they would be interested in digitally manufacturing bone models for orthopedic surgical simulation training.
Au moins, il y a un endroit en Haïti où vous pouvez retrouver une entreprise qui peut vous aider à fabriquer ou encore imprimer l'un de nos modules. Vous pouvez toujours les contacter. C'est fablabhaiti.com pour savoir s'ils peuvent vous aider à obtenir ces modules.
Sorry, just give me 1 second here. I'm just gonna okay, sorry. Just wanted to show a video here. Okay, so before I move on, does anybody have any questions?
Avant de continuer, est-ce qu'il y a aucune question?
Okay, great. No, pas de question? All righty, okay, no problem. All right, so we'll keep moving along here. So let me actually show you, go back here for a sec. So now that you've you found a local 3D printer in Haiti, then we've provided you with information on a little like outreach email you can send to them and get them, you know, contract them to locally make a 3D printed bone model for you. And we did a little cost analysis, and what we discovered actually is that 3D printing bone models locally in Haiti is quite a bit cheaper. It's about you know 2.5 times cheaper and about 42 times faster than importing you know commercially available bone simulation models from abroad.
On a pu analyser à travers le monde et en Haïti pour faire une estimation du coût. En général, si vous utilisez un modèle en Haïti, ce sera 2 fois moins cher de façon locale et environ 40 fois moins cher si vous devriez importer des modèles à haut coût à travers le monde.
Sorry, there's one question in the chat. They're asking how many times can a module be used?
Oh, you mean these bone models?
Yes.
Okay, so yeah, so they're made out of biorenewable plastic that costs less than 2 cents per gram. I mean, typically you would use them once for a procedure, but for yeah, so it's like a one-time use per procedure, and we have this module here, which is designed just to teach you biocortical drilling. And, you know, you can drill probably about, 30 times into this model here. But for modular external fixation, we typically recommend that you, that you use it once. And the reason why, oh, sorry, go ahead. Yeah.
Et en général, pour le tibia, la majorité de ces modèles, on peut les utiliser. En général, on recommande une seule fois, mais il y a pour les techniques de drillage, on peut utiliser jusqu'à 30 fois.
The reason why it's a single-use simulator is because the positioning of the pins is very important. So you don't want to be using it multiple times because there are optimal pin positionings that you would want to practice. So one of the principles of modular external fixation is you try and place the pins as far apart as possible in order to maximize the stability of the rod and pin construct.
Et en général, la raison pour laquelle on recommande d'utiliser ces modules une seule phase, on essaie d'avoir une position des bâtonnets ou encore des fixateurs de façon adéquate et à distance appropriée pour pouvoir obtenir une stabilisation aussi parfaite que possible.
And as well, one of the recommended practices for placing pins close to the fracture line is you don't want the pins closer than 2 centimeters from the fracture line, because you worry potentially about there being a fracture hematoma, and you don't want to put the pins into the fracture hematoma because that could potentially, spread an infection across the fracture.
En termes de technique, on recommande de placer le fixateur à un niveau qui est adéquat, environ 2 cm par rapport à la ligne de fracture, pour essayer de minimiser le risque d'hématome intraosseux qui peut propager une infection.
And as well, the FAR pin in the proximal fragment, you want it to be medial or distal to the tibial tuberosity to avoid tethering the patellar ligament.
Et pour la tige qui est proximale, on recommande de le placer de façon médiale ou inférieure à la tuberosité tibiale pour empêcher de ne pas causer une atteinte de ligament tibial.
And as well on the FAR pin in the distal fragment, you want it to be at least 2 finger breadths from the medial malleolus.
Et pour la tige qui est distale, on recommande d'être en moyenne 2 doigts en-dessus du malléole interne.
So for all these reasons, because these anatomic landmarks are critical for the proper pin positioning, we don't recommend that you use these models more than once.
Pour toutes ces raisons, le fait qu'on doit utiliser le fixateur avec des repères qui sont tout à fait adéquats et anatomiquement appropriés, on ne recommande pas de les utiliser plus d'une fois.
However, these are made out of biorenewable plastic called polylactic acid, PLA for short. And certainly there are some maker spaces or fabrication labs that you could, in theory, return your bone models to once you've used them. And they can take that plastic and actually grind it up and make new 3D printer filament from it. So your bone models can actually be upcycled into some other plastic object.
Et en général, certaines fois, on peut toujours retourner ces modules après leur utilisation à la compagnie qui pourrait peut-être les recycler. Ils sont fabriqués de matériel à base de polyacide acide qui peut peut-être recycler ce genre de matériel.
I see that there's something in the chat. Is there another question that's come up in the chat?
I think they are asking, how much does it cost in general for a 3D printers, and do you know if there's any organization that might subsidize the cost of this material for University Hospital in resource limited setting?
Right. Yeah. So so how much do these 3D printers cost? Well, some of them, as I'd mentioned, are as inexpensive as less than $200. So let me see if I can find an example. Yeah. So we actually have a list here of different printers with, different prices. And so this one here is, as you can see, less than $200. And we have actually, we as well as other fabrication labs have manufactured these in different places around the world. What was the other question? Oh, are there ways to subsidize? Potentially, yes. What we have been trying to, what we're going to try and do beyond this, the completion of our design challenge, is look for innovative public-private partnerships in order to help subsidize the costs of not just the bone models, but the consumables like the pins for learners.
En général, ce type d'imprimante coûte en moyenne $200, peut-être moins, et très probablement, il y a des moyens pour avoir un partenariat entre le secteur public et privé pour non seulement subventionner ces modules, mais également de vous aider avec les équipements.
And if that's something, you know, you or your hospital may be interested in, please feel free to contact and reach out to me anytime.
Et si c'est quelque chose que vous-même ou votre institution en a un intérêt, vous pouvez toujours me contacter, on pourrait faire le suivi. How long does it usually take for a practitioner to gain the full competence with or without supervision before they can actually themselves, you know, practice these techniques?
So how long would it take for them to acquire these skills?
Yes.
So it depends on the practitioner. We provided all the materials that they can teach themselves. We have the like the medical knowledge, right? You know, review of anatomy, you know, how you you know, manage the patient preoperatively, postoperatively, you know, how you perform the procedure and how you follow up on this.
Okay.
And then we have the skills practice. And so I'm happy to show you the our skills practice page here. And so we have all the objectives. You know, we review what equipment you need. And the other thing we do is that we've created a procedures checklist. So what that means is that when you're learning how to do this, you should have, just like you always have an assistant in the operating room, you should have a, you know, a friend, you know, a colleague, and they can, you should review the checklist before, you know, you know, conduct the, you know, simulation skills training. But your assistant can also read off the checklist and make sure that you did everything correctly. So, and then afterwards you can review it and make sure, you know, did you do the, you know, perform the procedure correctly? If not, you can practice again. And as well, we get you to take pictures afterwards of your, you know, of your, I guess your simulation training. And there's actually 5 pictures that you take just to confirm that in fact you did the procedure properly. And so we tell you how, you know, what the angulation, you know, what the acceptable angulation, rotation, and bone apposition, which is, you know, cortical contact, what it needs to be. We tell you what the, you know, the length discrepancies are, you know, what's acceptable. And, you know, you take pictures, basically an anterior view photo, this is a medial view, a lateral view. You want to make sure that none of the pins actually perforate the far cortex. You can verify this. And then as well, we measure something called the drill trajectory angles, which are, you know, ways that you, it's how you position the pin in the tibia, you know, to avoid potentially, you know, entering or damaging, you know, vital soft tissue structures. And so,
en général, le temps pour acquérir ces techniques vont varier en fonction du participant. Et nous avons nos modules avec étape par étape en ligne où, après avoir acquéri ces techniques, en général, on recommande que vous avez quelqu'un qui est là avec vous durant la simulation pour vous essayer de guider. Et on a une checklist qui va essayer de vous donner beaucoup d'informations en termes d'éléments qu'il faut suivre. Et on recommande après de prendre des photos avec différentes angulations et qu'on va revoir et à la fin, on peut vous donner un score pour savoir comment a été votre performance.
And so the actual training we have, have sort of estimated, might take, a couple hours, but that would, that's just an estimate. I think the actual skills training certainly doesn't take as long as that. That sort of includes, reviewing the other materials. But what I can show you, just 1 minute here, is that I was in Nigeria in, I guess, last month, and we've already had medical officers who have conducted this training. Just bring it up here so you guys can see it. And not only have they, taught themselves by practicing on these locally reproducible open source 3D printed bone simulators, they have actually already conducted their first clinical case.
Et les modules, encore, les techniques vont prendre en moyenne de 2 à 4 heures pour pouvoir les réviser. Et la dernière fois, j'ai été au Nigeria, on a même des médecins qui ont déjà utilisé ces techniques après avoir acquis les techniques nécessaires. Ils ont déjà réalisé leur premier cas clinique. Do you have any video joining these modules on the website?
Yes.
Where they can follow step by step?
Exactly. Yes, we have certainly provided that.
Mm-hmm.
So in addition to the procedures checklist, we have images as well as short video clips
Mm-hmm.
that explain how to perform this procedure.
Alors, j'ai demandé s'il y a des vidéos qui accompagnent ces modules. Il nous a dit oui, il y a des vidéos qui vont essayer de vous aider en plus des checklists pour pouvoir aller étape par étape, des courtes vidéos.
Okay, great. So yeah, so that's I guess the big question is, how long does it take for somebody to learn how to do this? Well, it sort of depends on the practitioner. I mean, some people may be able to do it once and then they feel confident. Some people may need to practice more than once. But we have designed it so you don't require a mentor, that any practitioner anywhere in the world at any stage in their career without a mentor should be able to teach themselves, the skills that we've described here.
Et ces vidéos sont très courtes et on n'a pas besoin beaucoup de supervision pour pouvoir regarder ces techniques. I think one of the big elephant in the room, getting the knowledge is one, but also having access to actually the equipment, the fixators, that will be the main issue. I don't know in general how much these fixators usually cost around the world, and having them really available for all the practitioners.
Yes, so a couple things. The thing about modular external fixation is that most of this is reusable. The only thing that's a consumable are these pins, also called shunt screws, right? You should not reuse these because when you drill these typically become dull over time. So but from a training perspective, what we are encouraging is these whether it's a fabrication laboratory or makerspace or some sort of centralized maybe training center, that they function as a simulator equipment lending library, meaning that so for example, it doesn't make sense for every hospital to purchase this equipment separately for training. That perhaps when you as a learner you're finished, these would not be reused, but these certainly could be. and that you could loan them to another, practitioner or another hospital once you're finished.
J'ai demandé en général combien coûtent ces équipements de fixateurs externes. En général, elle a dit qu'on peut toujours réutiliser les équipements, excepté les vis, une fois perforé l'os, on ne doit pas les réutiliser. Ce qu'on recommande pour au moins les séances de formation, c'est d'avoir un centre centralisé où vous pouvez avoir beaucoup de gens qui peuvent venir et apprendre des techniques et essayer de réutiliser les matériels le plus que possible. Yeah, that's one aspect for having a centralized training center, as some part of Haiti might have. You can bring everybody in and be able to reuse most of the equipment. But once you learn or you acquire the skills, I don't know how much it would cost for individually to have enough of the supply available, at least in some of these regional hospitals. I was trying to get a sense of the overall cost of these tools.
You know what, it probably varies according to the, the local surgical suppliers.
Mm-hmm.
We certainly encourage people to buy local.
Mm-hmm.
So one of the benefits, I forgot to mention, one of the benefits of 3D printing these bone models locally is, well, it's also, cheaper and faster for the practitioner, but it also potentially supports the local economy as well, that if you're purchasing them from your local, makerspace or fabrication laboratory, that, provides, revenue, locally as well. So now there is a social enterprise based in the United Kingdom, and they do, they're called Medical Aid International. They do provide an external fixation package at, I guess a very affordable cost. And so, and you're certainly welcome to contact them. That's one of the reasons why they're on our website here. And now the I guess potential drawback. I mean, this is a very affordable option. However, because it's coming from the United Kingdom, it may take a little bit more time to import into Haiti. So you may want to give them, a lot of advance notice. That being said, so, there may be an argument to be made to still purchase from your local orthopedic surgical hardware supplier in Haiti, because likely the delivery or shipping times would be faster.
Et le coût pour les matériels vont varier en fonction de l'endroit. En général, on recommande de les obtenir dans votre pays local pour essayer de supporter votre économie. Mais en général, il y a une organisation qu'on appelle Medical Maker qui est listée dans notre site, qui est basée en Grande-Bretagne, qui peut toujours vous acheminer ces équipements, mais en général, il faut tenir compte du coût de shipping et également de la douane et le délai que vous pouvez obtenir si vous placez une demande pour ces équipements. Mais il faut surtout essayer de localiser ou contacter votre supplier local pour savoir comment est le coût de façon locale ou encore au niveau sur le marché international.
And as well, you're certainly welcome to use it. Oh, sorry, go ahead. Yeah. Oh, another question? Do we have another question? I think we're running out of time, actually. Wow, this is hopefully you guys have been very interested in this. There's been lots of great questions. There is a oh, sorry, go ahead. I didn't mean to interrupt.
No, sorry. I was saying that I think you had shared the link with me. It's okay if I share the link with them?
Of course, yes. This link here? Yes, absolutely. Yeah, this is all open access. Yeah, of course. Yeah.
Okay.
So yeah, so there is actually, oh, sorry, let me just switch back to, yeah. So you're welcome to use any, locally available orthopedic surgical drill that's compatible with, 5.0 millimeter pins. But there is a product made by a Canadian social enterprise, and it's basically designed for, resource constrained settings. And one of the advantages is that they took like a off the shelf orthopedic surgical drill, just an off-the-shelf regular drill, and added a chuck adapter so you could put in pins. But one of the advantages is that it has a autoclavable kind of apron or cover. So that allows you to quickly change out, usually, reprocessing a drill between cases can be quite a time-consuming process. And particularly if your hospital is not used to, doesn't do a lot of orthopedic procedures and they aren't used to, to doing those types of turnarounds. But this makes it a lot easier. It's called the Arbitus Hex Drill and Arbitus Medical, Hex Drill. And now you have, you can just, when you purchase the drill, you can, and this is, I believe, FDA approved and Health Canada approved, you can just change out the apron in between cases. So this allows you to do sort of back-to-back orthopedic procedures. So that may be something your hospital might be interested in as you build your orthopedic surgical capacity, as more and more medical officers, become trained or teach themselves how to do, limb-saving orthopedic procedures.
Si vous n'avez pas tous les équipements orthopédiques dans votre institution, il y a une compagnie qui est localisée au Canada qui s'appelle Arbitus Medical qui a pu reformer les drilles non orthopédiques et placer un adapteur qui va vous aider à avoir probablement le même résultat, et cet adapteur est accompagné d'une couverture qui va vous aider à maintenir le champ chirurgical approprié et également de façon rapide de pouvoir changer ou encore de le réutiliser pour des cas subséquents successifs, sans perdre de temps. Et que c'est un appareil qui est autorisé par le FDA aux États-Unis.
And just to let you know, what we're also working on and getting ready to launch is a similar module, but this one would be for the upper extremity. So just wanted to make you aware that we're getting this one ready as well. And then we also have another module that you also might be interested in. But we're creating a module also using 3D printed bone simulation models that would empower not just medical officers, but even traditional bone setters, pre-hospital providers, clinical officers, nurses, nurse practitioners, to actually perform handheld ultrasound diagnosis of pediatric distal forearm fractures, which are one of the most common fractures in childhood. So because as you're probably aware, there's actually billions of people who don't have access to diagnostic imaging, and ultrasound is also transforming that. You can connect a portable ultrasound to either an iPad or even your smartphone. And so we are also working on creating a 3D printed bone models that you would then put in a 3D printed mold and pour gelatin into to simulate the soft tissue. And then you can practice your ultrasound diagnosis skills. And depending on what you diagnose on ultrasound, you can either verify there is no fracture. You can identify what's called a buccal fracture, which is also managed relatively conservatively, with bandaging or, safe splinting, or you would identify a cortical break fracture. So that could be a green stick fracture. It could be a complete fracture or a Salter-Harris physial fracture. And in those cases, those would need to be referred out for, additional imaging and potential, specialist care. So yes, yeah, so
nous avons d'autres modules qui vont venir en rapport avec les fractures au niveau de l'humérus et des fractures pédiatriques. Et des fois, on peut utiliser des appareils sonographiques comme le Butterfly qui peut des fois vous aider à identifier les types de fractures. Certaines d'entre elles peuvent ne pas nécessiter une intervention chirurgicale, d'autres vont nécessiter une référence dans des centres tertiaires. Mais en général, ces modules vont vous donner une idée dans la majorité des cas pour pouvoir stabiliser encore, fournir un traitement qui est adéquat.
So yeah, so I think we've run out of time. I apologize. We've got a few minutes over, but does anybody else have any other questions?
Do you have any idea if they use this module even in places where they have orthopedic training, so the fellows can use them as a learning skill? Because there might be a lot of places like in Haiti with instability or political turmoil where even people doing the surgical residency might not have enough time to practice. I'm thinking about like having a first year fellow or even student in medical school using them as they go along.
Absolutely. Yeah, I mean, yes, the answer is yes. Certainly, orthopedic surgical residents would be welcome and encouraged to teach themselves. Part of this is designed to accelerate and expand the teaching of these essential orthopedic surgical skills. So yeah, absolutely, yeah.
Et les résidents en chirurgie orthopédique ou encore les médecins ou encore les étudiants peuvent toujours utiliser ces modules s'ils n'ont pas accès à des cas adéquats. Le but en général, c'est d'essayer d'expandre l'application de ces techniques chirurgicales en dehors de la sphère orthopédique. Il n'y a pas d'autres questions?
Oh, sorry, go ahead. Yeah.
Thank you so much. I don't think there's any more questions. If they have any more questions, I can ask them to email me.
Can I ask you guys for a favor? If you just want to turn on your cameras super quick, and just so I can see your faces, if you guys want to wave. I just want to take a picture. My mother will be so proud of me that so many people from Haiti came out to holy smokes, look at you guys. To see my talk, so early.